Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony.
We are constantly looking at where we have increase in cases, and we have teams in the region, and in those regions, the relevant RHOs and so would be working to make sure that we can control the situation in those regions. We continue, apart from testing and knowing where people are located, if they need to be quarantined or isolated, we still have government facilities that are operational. But so far, most of the persons that we have, they are isolating at home, and I think that's a good thing. As of yesterday, we've had 132 sites across the country. Some of those sites obviously is in Region 4, but we had operating yesterday 132 sites by different regions, and we've seen a lot of people coming out to get their vaccines. Yesterday alone, we did 4,930 vaccinations. Of those, 4,329 were persons receiving their first dose, and we had 601 person who got their second dose. We have seen a lot of persons who are reluctant coming forward and getting their vaccine, and I think that's a positive thing. So we'll monitor to see how that is affecting our capacity to deliver service, but ultimately we want people to be vaccinated because our staff, they are on the front line. If you're a medical staff, you are constantly in contact with the general public and you're offering service to the general public, so which puts you at risk if somebody is infected with COVID. And the best way that you can reduce that risk really is to be vaccinated. And so we hope that our staff consider those who are reluctant, that they seriously consider getting vaccinated. If they're not, if they don't want to be vaccinated, then they will have to get a PCR test and bring it to show that they are not infected. Well, we are monitoring the different departments there. We had some persons who were vaccinated and they were able to come to work and to continue working as normal. And there are lots of other persons who refused to take the vaccine, putting themselves at risk, and of course, they didn't come to work. They didn't show up with a PCR. Look, this thing is a public safety matter as well. So imagine if you're vaccinated or a patient who's unvaccinated come to the hospital and you have staff that are unvaccinated working with you. So it's something, it's ethical, it's moral, and we have to protect ourselves. And I really do believe that with a little bit more education, that the healthcare workers who are reluctant would understand the importance and the need to get vaccinated. So we hope that this would happen sooner rather than later, and we continue to monitor to make sure that the services that we are delivering is not compromised.
Sure.
The ministry is not standing any pause. The total number now, we have 275,451 persons who are now vaccinated with the first dose of the vaccine. That's approximately 56.6% of our adult population. And we have now 145,566 persons who are now vaccinated with a second dose, so that would be about 29.9% of our adult population with second dose vaccine. We do have a lot of vaccines that is available, and people really they have a choice. So we have AstraZeneca vaccine that is available. We have Sinopharm vaccines. We have Sputnik V, the first dose. Later in the week, we are anticipating that we'll get about 50,000 or so doses of AstraZeneca that is coming from COVAX. 20,000 of those doses have been a donation through the French government. They did that donation through COVAX, and so we are expecting to receive that on Friday. So we have right now in the system, we have enough first and second dose AstraZeneca and Sinopharm, and we have enough Sputnik V, and we're working to make sure we get the second dose of Sputnik V. We are expecting some within the week, and once we get that, we let people know, so those who are due for their second dose would be able to get it. No, of course. There are lots of people who have received vaccines, and they're protected instead of dying. They're these vaccines are meant to protect people, prevent COVID-19 disease, and so these vaccines would allow you to live, not to die.
Well, that's it for today's COVID-19 update. We just spoke with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.